Hi, I'm Dr. Shabeeb, and today I'm going to talk to you about all the options for replacing missing teeth. So there's a few options, some are better than others, and I will list the main benefits and the main drawbacks of each option. So option one is dentures. Now there's different types of dentures, but basically what a denture is, it's a plate with teeth on that you put in your mouth and you take it out at night. It's not as good as the other options in terms of function, but the main benefit is that generally speaking, it's cheaper. So let's talk about, let's say for example, an acrylic denture. So the issue with dentures is that it resorbs bone and it isn't very comfortable to wear. So what I mean by that is, imagine a thick piece of plastic that you have to put in your mouth. Especially initially, it's a very uncomfortable thing to tolerate, and it has a very steep learning curve. Because it rests on your gums, with the case of an acrylic denture, it resorbs your gums and it resorbs your bone, which changes your face structure, it weakens your other teeth, and generally speaking, it's the worst option for replacing teeth. With a metal denture, it's a little bit better, it sits on your teeth, but it's still not the best option. Option two is bridges. So a bridge is basically a fake tooth that's anchored onto real teeth. The benefit of this option is that it's a quick fix. So it only takes 1 or 2 appointments to carry out. And the drawback is they're not very good long term, because you have to shave the healthy teeth into stumps and you end up with a bigger gap when the bridge fails. So the third option would be dental implants, which would actually be the best option. And the reason being is you don't have to touch the neighboring teeth. It goes directly into the jawbone, which stimulates and preserves the bone for you, and it lasts the longest. So the main drawback is that it takes a few appointments, and it takes 2 to 3 months for the implant, once it's placed into the jawbone, for it to fuse with the jawbone before you place a crown or the tooth onto the implant. So it takes a few more appointments, a little bit more patience. It does require you to undertake the implant surgery, which isn't as painful as people think. You have it under local anesthetic. And another drawback is that it does cost a little bit more than the other two options. But if you think of it long term, it costs less because you pay once and you have the implant for decades. Whereas with something like a bridge, for example, once it fails in 10 years, then you have an even bigger gap and you have to pay for more replacement options. So if you want to know what options are best suited for you, then book a free consultation using the link below or give us a call and we'll talk you through everything. So from the time frame to the procedure to the costs involved, we'll answer all your questions and you leave the surgery knowing what the options are. Thank you so much for watching. Make sure to like and subscribe for more dental tips and content like this.